This morning, a coronavirus vaccine is one step closer to rolling out across the country. We are awaiting a final decision from the FDA.
And News 8's Chris Groh joining us live along Harbor Island with a closer look at what's next and what can we expect here in San Diego. Chris.
Hey, good morning, Eric and Netta. And look, I know that a lot of people are anticipating this, especially after maybe even watching hours of that testimony from Pfizer officials. We saw independent doctors and scientists going over data, but that's not quite the end here. We still need to wait for the FDA to release their authorization here of the Pfizer vaccine. Once that happens, we will then see those doses spread out across the country, including more than 28,000 doses here to San Diego County.
The individuals or healthcare workers that we are focusing on are in acute care hospitals, psychiatric hospitals, and correctional facility hospitals.
And so then you hear there Dr. Wilma Wooten going over who will receive this vaccine first in San Diego County. And much like across the country, we are starting with frontline healthcare workers. But something that was pretty interesting was the fact that this is going to be maybe a little bit of a slower process than we thought. That first shipment that we should be getting, which will be stored at 3 different locations that we know of, Rady Children's Hospital, UCSD Medical, as well as Health and Human Services Agency, that's only going to have about 72% of, it's only going to be able to vaccinate, I should say, 72% of the healthcare workers in the county. Once they get done with that, they will then move on to those nursing home residents and the staff there. Now that process itself, everything I just covered, could take the rest of the year, the rest of December. And remember, everyone will then need a second dose coming up probably in that next year, starting in January, because this is a 3-week gap between the first dose and that second dose. So everything being considered just now, it probably means that we, as the general public, those without pre-existing conditions, those not 65 and older, or not an essential worker, will likely be waiting until the spring, summer, maybe even late summer, fall, before we receive that first dose of a vaccine. But again, this all hinges on when that emergency authorization will come from the FDA, and then how quickly the process, the transportation, the storage, so much of this goes into it, so many logistics. That's hence Operation Warp Speed, a big part of this. But for right now, the general public is still looking at that summer, late summer date there to be getting their first vaccine dose.